Welcome to Caring Well.
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 Hey everyone, welcome to Caring Well, Middleton Pediatrics podcast, where we explore topics and talk with guests who will help you care well for your child. Today we have a conversation with Brooke Simmons. She's a lactation consultant, and we explore the topic of breastfeeding. So I think you're really going to enjoy what she has to say. Let's jump to that conversation. Brooke Simmons, welcome to Caring Well.
Thank you so much for having
you.
me.
Oh my goodness, this is going to be so much fun. Just as a way of getting started, a lot of places I want to go in this discussion, and certainly you feel free to take us wherever you feel like would be most helpful. But as a way of getting to know you and just getting a little bit of background, maybe tell us in whatever official ways you usually describe yourself, what it is you do and how you got into that.
Okay, so I am an international board certified lactation consultant. So a lot of letters behind
That is a
my
lot of
name.
letters.
Yeah. So I got started in this line of work after having a lot of breastfeeding issues with my first baby. It was really hard, young mom, not a lot of support with breastfeeding back then like it is now. And so that baby was my formula fed baby after about 3 months. And then fast forward to having my second baby 26 months later, I decided that I was going to breastfeed that baby. It did not matter. Nobody was going to say.
And you're not in the field at this point.
No,
Okay.
no. I was just a mom.
Yep.
And so I successfully nursed my second for almost 34 months. And so it was sometime when that one was she was probably about 4 when I decided I think I want to pursue this as a career. Because if I had issues nursing my baby, other people did too. So I actually started off as a peer counselor with the WIC program. I went through their training. It's about a 6-week program. And then I went on to become a certified lactation counselor. So that's a 1-week training course. And then went on to get a bachelor's degree in lactation. I went back to school while being a homeschooling stay-at-home mom and got a bachelor's degree in lactation. I spent about 9 months in an internship program within my bachelor's program with Pat Lindsay. And then graduated, and I've been an IBCLC for almost 9 years now.
So IBCLC, is that, if someone was just looking for a lactation consultant, are all those things you just mentioned sort of represented, or are the majority of lactation consultants IBCLCs?
Yeah, so IBCLC is the highest
Okay.
gold standard of lactation care that you can go to.
Well, so if a parent was looking for someone to help, what is the added training and experience that IBC? I do feel like there's someone who needs to come up with either less initials or maybe a quippy little nickname for that, because those letters really don't IBCLC.
It's a lot. Yeah, it's
anyway,
a lot.
so what is it that they're getting that's more than these other things?
We have a lot of lactation specific education training that we've gone through, and a lot of in-person hands-on training. I was in internship within my program for 9 months. So 5 days a week, 8 to 5 with, an IBCLC, shadowing her. And I've always said that I learned more in my 9 months with her than I did in my whole bachelor's
Yeah, that's
program.
a good old-fashioned apprenticeship.
Yeah, yeah.
That's great.
So there's a big difference in a CLC and an IBCLC. CLCs are wonderful. They, are there to help, but it's more peer-to-peer.
Okay.
An IBCLC, our scope of practice is a little bit different.
Okay. Well, speak to that, your scope of practice. Give us a day in the life of a lactation consultant.
So I'll give you a day in my average day of life of Brooke Simmons IBCLC. So I usually get up in the morning and check my schedule, see what I have on the day. It can be home visits, office visits, depending on the day, responding to messages, emails, phone calls before I head out for the day. So I try to get all those handled before I even leave the house in the morning. Double checking that all of my intake paperwork is ready so I know what I'm walking into when I get into a client visit.
Mm-hmm.
So I get a lot of health history from moms ahead of time.
Even before you meet with them. Okay.
I do. I try to get all of that done before the visit, because when I'm walking into that visit, I'm asking that the mom have her baby ready for a feeding. So the worst thing is to walk into a visit and need all this intake paperwork done, and we have a baby that's so ready to eat. So we try to get that done ahead of time.
You mean babies aren't very patient in
They're
those
not
situations?
patient
Yeah.
at all. No. So we try to get that handled ahead of time. And I just like to look and see what I'm walking into. That way I know what to expect. Have any supplies and stuff that I need. I double check my home visit bag to make sure I have nipple shield syringes, anything that I might need ahead of time. All my pump parts are clean and sanitized for any pump flange fittings and things like that.
How do you decide? I mean, I want you to keep going with your day, but how do you decide home visit versus office visit? Is it purely preference on their part?
Yeah, preference for the mom. Some moms prefer to book a home visit if they are maybe post-surgery or just prefer to have me come to them because it's easier. Maybe they have other children or it's hard for them to get to the office. Obviously, there's different fees for one visit versus the other, but it's really just a personal preference.
Do you find, I'm sure both are incredibly useful, do you find the home visits more? I mean, I think even like pediatrics in an ideal setting would be done in the home.
Yeah, I think for a lot of moms, it is easier for them to be in their environment, set up in their space. So sometimes when I have a mom that's in the office, if she is having a hard time, and I've seen her multiple times in office, I do recommend maybe we should see you next time in your home so I can see what's happening. Because sometimes there's that disconnect, right? Like we can get everything perfect. Everything works so well in office, but then she gets home and something's not working right. So what's happening at home? So sometimes it just works better so I can see her in her environment.
Well, you just had me curious suddenly. What would be, I could very easily see why it would go better at home than in the office, but what would cause the opposite?
Sometimes she gets in her head about things, maybe it's her setup isn't great at home. She can't get super comfortable. Maybe we have pets at home that are distracting.
Other stuff going on.
Yeah.
Setup.
Yeah.
I would assume that is an important part of this activity.
Yeah.
In whatever, 15 words or less, what's a great setup for breastfeeding?
Super comfortable. I can give it to you in 2 words there. Super comfortable. We need mom to be super comfortable and relaxed when she's sitting down to nurse her baby. If we think about the baby being in mama's belly, super comfortable, the most amazing hotel room ever. Okay. And then these babies come out and that hotel room is not there anymore. And so if mom is super anxious or nervous about the feeding not going well, the minute she sits down to feed this baby, if she's having those thoughts, then the baby is also feeling that. So I really try to work hard on getting mom nice and comfortable and relaxed before I give her the baby for her to latch the baby on.
And I would assume hardly ever does that mean purchasing something that they have.
Yeah. I work with what she's got.
Yeah.
Yeah.
And that's usually sufficient.
Her bed, her couch, the dining room chair, if that's where she tells me she's super comfortable.
Okay.
Yeah.
Before getting into any problems you see, if you were thinking of breastfeeding as sort of a chronological journey, you have pregnant moms, moms that have just delivered in the hospital, moms that have home week 1 and then beyond. Kind of think of each of those segments and what would be some just high level, really key advice you would give for each of those. So again, pregnant mom, just delivered, just got home, and then month 1.
So for the pregnant mom, if it is your first baby and you've never taken a breastfeeding class prenatally, definitely find one and take one because it's very helpful to know what to expect in those first couple of days of nursing your newborn baby. For the hospital, wake your baby and feed your baby. It goes against what everybody says. Don't wake a sleeping baby. But the more you nurse your baby in the first 24 to 48 hours, the quicker that milk is going to come in for you, which helps to combat some of that weight loss in the beginning. So that would be the first, couple of days in the hospital. And then once you're home, if you're having struggles, reach out sooner than later. Get seen by somebody.
Lactation classes for pregnant, are those easy to find?
I definitely teach one. I know that sometimes you can find them in the hospital. You can find them online as well. In my classes, I do a lot of hands-on stuff with mine. So I'm handing you a baby doll. I'm getting you to put that baby doll in different breastfeeding positions with a breastfeeding pillow, getting you super comfortable with moving a baby around. So when they get into those real life scenarios, they're more comfortable moving a baby around.
Speaking of first week, and some of this would be in hospital, some of this would be once you went home, it does feel that milk coming in is such a game changer.
Yes.
That the game prior to milk coming in is very different than afterwards.
Yes.
Speak to that a little bit. Speak to how it's different. And then I want to ask you some specific things, even about content, meaning colostrum and milk and things.
Yeah.
But speak to what difference, the dramatic difference that milk coming in makes.
So in the first couple of days, those babies are not getting a whole lot every time they nurse. So the more often you put the baby to the breast, the quicker that milk is going to come in for them. So they're going to be a lot more satisfied when they go to the breast because there's going to be more milk volume. And so it keeps them more satisfied, and then they just are a lot more calmer. And
What if someone says, when should I expect my milk to come in? What is your stock answer?
Gosh, that's such a loaded question, right? Because it can be a lot of different variables for every mom. But typically between days 3 and day 5.
Okay.
But there's also a lot of different variables for that. Did she have IV fluids during her delivery? Was there excessive blood loss during delivery? Were we having a C-section? First time mom? So again, so many different variables with that. But typically days 3 and 5.
You said in the hospital, wake your baby and feed your baby.
Yes. Wake your baby.
Sometimes I hear parents saying, easier said than done.
Yes.
What are your tips for waking babies who don't want to wake?
Get rid of the wipe warmers.
Okay.
Yeah, cold wipes on babies when you change their diaper, and then undress your baby, unswaddle them. Lots of baby massages and rubs, and just a lot of, stimulating them, laying them skin to skin, doing that baby massage, and then sometimes even moving them away from you. When they get right here, they get nice and warm and cozy and snuggly, and they think they're back in the womb, but just moving them away from you, and then getting them undressed. So sometimes we think that getting them nice and warm, and the onesie, the socks, the hat, and the blankets and stuff to keep them nice and warm. But when we do that, we create that nice womb environment for them again. They wait for womb service,
right?
And that womb service doesn't exist anymore when they come out.
If someone came to you and said, "Hey, Brooke, what are the benefits of breastfeeding?" and both to the mom and to the baby, and then I may even press on the question a little bit, but I'll let you answer first.
So the benefits for the mom are, it makes her for lower risk of type 2 diabetes, breast cancer, ovarian cancer. Her blood pressure is lower. She might get back to her pre-pregnancy weight faster. Not all the time, but sometimes they do. And then for a baby, the mom is custom making that milk for her baby when her baby needs it. Formula companies can't do that. They're making milk for all the babies. Lower risk of SIDS, ear infections, eczema, vomiting, diarrhea.
A lot of this does fall into our world.
A lot of the stuff that we're seeing in these little kids when they, in the first, 6 months of life. So when a mom is going back to work, if she is around people that are sick and she gets that cold, she is producing those antibodies in her breast milk to fight off whatever it is that she's got and passing them to her baby. So formula can't do that.
I feel like every mom is wanting to do what's best for their baby.
Right.
They hear so much about the benefits of breastfeeding. And I think in the last, let's just say 25 years, there has been so much intentional effort towards encouraging breastfeeding.
Right.
Good and good, right? Because of that, when it isn't going well, there's a lot of emotion.
Yes, a lot of pressure.
And even guilt on the part of moms that I'm not able to do what is best for them, or I may not be doing it well. How do you handle that?
Well, and I think that's where having been on both sides of the feeding spectrum with my own personal kids, I can really relate to some of these moms and their struggles with breastfeeding. We have to meet moms where they are in their journey. And I try really, really hard to, obviously let them know that this is not their fault, right? And try to make them feel good about any amount of breast milk that they're able to provide for their baby is better than none. There's a lot of mom shaming that goes around with breastfeeding, and it's really hard for these moms that want to breastfeed so bad and just can't for whatever reason. And so that's why I try really hard to help them to prioritize their mental health first. I've had the tangents. I've had a couple moms that have been on the opposite end of that, where they've been overproducers and it's been so incredibly painful, where they've stopped because of the pain with breastfeeding. So it can be on both sides of that spectrum, but I think we always have to prioritize mom's mental health first and foremost. It doesn't matter if things are going great, things are not going great. Her health is just as important as that baby getting breast milk. And that's where it's really hard for these moms to separate that mom guilt of, I've tried everything that I can and it's not working, so I'm failing my baby.
Your position is sort of at this intersection of nutritionist, kind of
Mental
midwife
health.
in the literal sense of
Yeah.
with the woman, and then
Mhm.
parental counselor.
Yeah. Yeah.
And that's difficult.
Sometimes these moms, they cry a lot. I cry a lot with them. And, because just as much as they want to breastfeed, I want them to be able to as well. And sometimes I'm the first person that's telling them that, it may not happen. And so that's where part of what I do is really hard, because I may not be the first person that they've seen. They've seen their OBGYN or midwife. They've seen nurses in the hospital and all of these other people. But I'm the first one that's letting them know that this may or may not happen for them. And that's where it's hard, because then are they looking at me as I'm the bad person for being that
Right.
first one?
Bearer of bad news.
Yeah,
Right?
yeah. But I always try to be honest with them and not give them a false sense of hope, because we don't need to do that to them.
One of we say sort of around here, one of our little missions is, it just bothers us so badly when great parents are made to feel like anything less than that.
Yeah.
And this is one of those arenas where it happens. So we could talk about why the emotions are such a significant part of breastfeeding, even though a lot of that would be, somewhat obvious and understandable. But even if things are going just like they should, there can be a lot of emotion that has the potential to undermine breastfeeding. So how do you turn down perhaps the emotions during those early days, that first week?
Lots of check-ins with mom. Make sure she's doing good. Make sure she's got the support that she needs at home, with, people that can check in and care for her. Let her know that she can check in with me too. And the ones that need those extra check-ins with you. And I always try to follow up with them and bring them back in for, even if it's just a quick weight checkup, mainly so I can just check in on mom and make sure that she's doing okay. I may not need the weight for the baby, but it's mainly so I can just lay eyes on her and make sure she's doing good.
That's great. That's there's some intangible aspects of care that's really just presence.
Yeah.
Right. I mean, this is again sort of unrelated, but I'd read about this study of women at risk for preterm labor and preeclampsia, and they started putting them in groups that just with other moms.
Yeah.
And that was the only intervention, and the rates of preterm labor went down, and sort of just not feeling alone. This is probably an area that is so easy to feel alone. So you almost said it without saying it. What is some very specific advice for the fathers, maybe for the grandparents, the people that are around this nursing mother? If you could sort of jump in and offer some really pointed counsel, what would you say?
Mother the nursing mother. Mother her. I mean, she's doing so much to mother this baby. Let's make sure that we are mothering her. make sure she's eating, make sure she's drinking and taking care of her needs. Everybody wants to come and see this new baby, rightfully so. But let's make sure that all of mama's needs are taken care of first before we jump in and let me hold the baby.
Have you seen, or maybe you have some very specific steps someone can take in those things? What would be some things that if someone said, oh, what are some ideas? How can I mother the mother?
I'm sure she's got a ton of laundry that needs to be done. So laundry is a big one, probably in a house with a new baby. Preparing a meal for the new family. If they have a dog, take the dog for a walk or care for other children in the home. I know those things were really helpful for us when we had a new
practical
baby.
Things, yeah.
And so if I see parents prenatally, I always tell them, have a list ready. Have a list of things that other people can do if they come over or if they're offering to help. Because everybody does, what can I do to help? How can I help? And so that way you can tell them, give them a task, give them something to do so they feel helpful, because it's the mama's job to care for her new baby, right? And to feed this baby. So let's give somebody who wants to come over and visit, let's give them something that they can do so they feel helpful.
Are there specific, whether they be fluid or dietary recommendations that you give to nursing mothers?
I tell her to drink to thirst. If you're thirsty, drink something. And then as far as food, I try to have her like grab a snack when you sit down to nurse this baby, because chances are she's not eating a whole lot. She doesn't feel super hungry, especially in the first couple of days. But I typically just tell her to add an additional, 400 to 500 calories to your normal daily amount of calories that you're supposed to intake every day. Just make sure you're eating.
Yeah. Yeah, that is, we'll often say kind of this, make sure you're hydrating, make sure you're resting, and make sure you're eating. And, they usually are doing a pretty good job hydrating. The resting, they're doing the best they can. There just aren't many windows to do it. The nutrition is the one that's most easily neglected.
Sometimes I tell moms to pretend like they're a house plant. Feed them, water them, and make sure she gets a little sunlight every day.
Oh, there you go.
Yeah.
Any foods that you regularly, specific foods you regularly recommend or discourage?
I tell moms to eat whatever she wants and don't avoid something because, the internet says to don't eat this or don't eat that, or grandmas are the worst with don't eat this. I tell moms, if you want to eat it, eat it. The baby will let us know if it doesn't agree with them.
Okay. Obviously babies are fussy.
Yeah.
And sometimes feel like moms are sort of given almost this, they make the connection that every time the baby's fussy, what did I eat? Kind of what, how am I at fault?
Yeah.
And we feel like that can be pretty tyrannizing because babies are just fussy.
They complain about everything and nothing.
Right. It probably has nothing to do with what is there any way you kind of help people try to navigate what something the mother ate that would be causing the baby to be fussy? How would you interpret that?
If it's somebody that I haven't seen in a little bit, I usually do try to bring them in and let's make sure, number one, they're not fussy because they're not getting enough milk.
Okay.
Sometimes that's the number one trigger,
just
right?
Not gaining weight.
Not gaining weight well. Or it's on the opposite end of that and they're eating too much because that can also make them fussy. But I would want to rule those out first. And then if both of those are fine, then we take a look and see what does their poop look like. If their poops are normal, yellow, seedy, mustardy, then it's probably not a whole lot in her diet that might be bothering this baby. Just try the normal list of things, I usually give them a list of things to try to see if it helps burp them well. Are we, and that's the other thing, making sure they're burping. If they're not burping, well, they're going to be fussy because of that. Swaddling, have dad burp because dads are usually much better at that.
Give them a job. Give the dads a job.
There's a job for dad. And then usually take them outside for a minute, change of scenery. That's usually a good one that'll kind of calm things down. Because usually once they start getting fussy, mom's anxiety level goes up a lot. And so it's usually just passing the baby to dad or someone else that can kind of help calm baby down. And usually mom will calm down a little bit better too. But I don't see a whole lot of food stuff. Obviously, if there's a whole lot of food stuff that we're concerned about, their poop is going to show us a whole lot too.
Let's speak to some specific parts of milk. Colostrum. sort of a mysterious substance in a
Yeah.
ways.
The original liquid gold right there.
Yeah, there you go. Teach us about colostrum.
It's super thick, super sticky. And that's if a mom is not going to breastfeed for whatever reason, we always try to encourage her to at least give colostrum to her baby. But it is packed with so much good stuff for these little humans. I mean, it's amazing. It's great. It can range in color, clear, yellow, creamy colored. And it's like every time they nurse, they're getting about a teaspoon in the first 24 hours. And then it starts to slowly increase into that more transitional milk.
Foremilk and hind milk.
Yes, I know that was one of your big questions. Was the
Yeah, I
foremilk
mean,
and hind milk.
so I guess one of the ways that it, there's sort of a message and I know some of the differences between the two and the importances of both.
Mm-hmm.
Some of the messaging I think that comes to moms is you can't miss the hind milk. And so it leads to some almost over nursing and prolonged nursing.
Yeah.
So maybe just speak to kind of what those things are, and then practically what difference should it make for how a mom nurses?
So foremilk is that milk in the beginning, that watery milk. And then as a baby nurses, we get into that more fatty milk. If a mom pumps and you leave that milk sitting in the fridge for a little bit, you can actually see that fat separation of the milk. So what I tell moms to do is to just nurse your baby. Okay. We as lactation consultants have no idea when it switches from foremilk to hind milk. No clue. So I tell her, just nurse your baby. Let them finish that first breast. When they come off and they say they're done, we sit them up, give them a nice burp, and then give them the second breast. Some babies don't need the second side. Some babies do. But personally, I don't get overly concerned about it. Babies know when it's time to switch to the second side. But there's a lot of people get very concerned about the foremilk and hind milk.
They really do.
But I think that goes with not timing them on the breast either. I think if you can just let them do what they need to do and kind of step back, step away from the apps with the timing, they know what they need to do.
Yeah, this is a little bit of a macro problem that in an age of information, and it's really, there's some desire for control and to ways to, if I'm more informed, then I'll be better at fill in the blank. And it really sort of undermines the whole endeavor a lot of times. And paralyzes.
I mean, I have the moms that come in, they sit down in the nursing chair at the office, and then we get the baby, the burp cloth, and they have their phone and they're like, wait, I can't start because I need to press my button to start the timer. And then those are the moms that are the ones that are really, really struggling. And the minute we move the phone away, you can almost see the anxiety start to ramp up just a little bit. But once I can get her to kind of calm down, we move the phone away and kind of relax a little bit, she relaxes so much more into that feeding and enjoying the moment and then enjoying her baby than trying to press the button on her phone. We feel like that is triggering a lot of that anxiety surrounding the feeding, because we're very much trying to have to set this timer.
A lot of tasks.
I have to do this.
Yeah. So do you actually often discourage the use of these things?
I do. Yeah, I do. Because when we just sit back and watch these little ones at the breast, they will show us a lot of things. What are they doing while they're there? Are they actually having those good sucks and swallows? Or are we just sitting there hanging out? And if they're just hanging out, it's mom's job to get them back into those bigger sucking patterns.
So you'd rather them be attentive and
to the baby and not that phone. Yeah.
Yeah. The thing that's so hard about that is often that which is better, attentiveness, is a little less defined and less metriced.
Yeah.
And I think, we all tend to somewhat be reassured by metrics, even though it may not be helpful.
Yeah. One of the good things though with the visits is I'm able to quantify with these mamas what their babies are actually getting. And so for them, that's really helpful to see, okay, I wasn't paying attention and then my baby just took 2 ounces. And then they ask, well, how long was that? And I'm like, I have no idea, because we were sitting and chatting and having a conversation. And so for them, it's a really big deal, because they were like, wow, that felt like it was so quick. So being able to quantify for them, it gives them the empowerment they need to not do the timing at home too.
I'd love to hear you speak to uh, some of the world of breastfeeding products.
Oh my
So
goodness. So
whether
many.
they be pumps, shields, Haka, I mean, all these different types of things.
Mhm.
So in any order you'd like, speak to some things you find helpful, how you would guide a nursing mother in the world of uh, breastfeeding things to be purchased.
Yeah, all the things. Well, I always encourage mom to check with her insurance company, because a lot of insurances will get moms a breast pump. So always check with your insurance and see what they cover, because if they'll get you a pump for low cost or sometimes even no cost, definitely utilize those benefits. I mean, if you're already paying for your health insurance, let's utilize that and see what they cover for you, because there's a lot of really good ones on the market that they will cover. And then as far as nipple shields go, so nipple shields can be a hot topic for some people, but they have a place. If we can't get a baby to latch on without a nipple shield, and this mom is having to pump her breast every 2 to 3 hours to provide her milk to the baby, but we can get this baby to latch on with a nipple shield, let's get her to latch this baby with the shield, and we can work on weaning him off of that shield in a little while. I would rather her put her baby to the breast with a shield than have to pump her breast every time. So that's my take on the nipple shields. I don't think that they're absolutely horrible. I do believe that they have a place and sometimes necessary.
What about pumps specifically? If someone said, what, not saying brands, but I mean, I'm
Mhm.
sure there's variations.
There are tons. So some of the wearables that we have on the market are really great, and then you have some that are not so great. So it just depends on the mom. Everybody responds to them differently. So it depends. Is this mom going back to work full time? Is she going to be a stay-at-home mom? What does she need the pump for? So those are the kind of questions that I do like to ask ahead of time and know, like, what are her needs going to be for using the pump?
Creams.
There's a lot. I mean, a mom showed me one the other day and I was like, "Oh, wow, I've never heard of that one
It's tough to
before."
keep up with these
Yeah,
things.
it is, because it's as fast as it's a new one comes out, there's 5 more on the market. So, I mean, always just use it sparingly. We don't need a whole big gob of nipple butter on the nipples, and sometimes you don't really need a whole lot. Your breast milk is great. Just use a little bit of your breast milk. It's got so many good healing properties in it. I mean, we know how good it is for your baby. Just use a little bit of that on your nipples too. But if you're having cracks and bleeding on your nipples, then we need to find out what's going on.
Bottle refusal.
Oh, bottle
It's a
refusals.
tough
Yeah.
one.
That's
Yeah.
it. That can be a tough one, because it's very um it can be very traumatic for mom and baby, especially if she's planning on going back to work.
So just for the listener, this is the child that maybe nurses great, but
Yes.
will not take a bottle.
Yes. So I
So the mom
recommend
is trapped.
the mom is very trapped.
Yeah.
And I've been that mom. My second baby would not take a bottle at all. So I had a 2 to 3 hour increment that I could be away from my baby before I had to get back home. Um, I always recommend, if you know you're going back to work, let's start bottle feeding sooner rather than later, so we don't end up with that problem. And I also think it's kind of smart for the breastfed baby to know how to take a bottle. In the event of any kind of emergency situation, you would want to make sure that your baby does know how to take one.
What is sooner for you? What is
Um, I typically start my babies around 2 to 3 weeks. Yeah, I find that they do pretty well with, going back and forth between bottle and breast, as long as we're not giving them the bottle too quickly.
and is there once they get it started, 2 to 3
Mhm.
weeks, is there a frequency you encourage to keep it as an open option?
Yeah, every few days or once a week,
Okay.
to make sure they still remember how to take one. If you just give one and you say, "Oh, wonderful, they know how to take one," and then we wait 3 months, it's a skill that they're not going to remember how to do.
Great. What about guidance on storage of milk, pumping and storage?
So definitely, there's a lot of different guidelines for that. You can leave your breast milk fresh on the counter for 4 hours, and then once you put it in the fridge, you have 4 days to use it. And then if you don't use it within that 4 days, you can move it to your freezer. So it just depends, what kind of freezer are we using? Are we using a refrigerator door freezer? deep freezer. So there's different, guidelines for that. Deep freezer, usually about 6 months. And then the refrigerator freezer, about 3 months.
What's a favorite part of what you do?
The babies,
Hmm.
those babies. There is nothing sweeter than, the babies and seeing mom reach her breastfeeding goals. One of my favorite things is getting the emails from the moms when they meet those goals that they've set for themselves with pictures of the babies. As somebody whose children are grown, who doesn't want to cuddle babies all day for work?
Right.
Yeah.
My daughter will often say, "You are so lucky. You get to play with babies all day."
Yeah, it's really the best. I'm sure everybody says that their job is the best, but hands down, 100% mine is the best.
All right. So the other end, what about most difficult part?
Having to tell a mom that she may not ever make enough milk for her baby. That can be really tough because I know how bad she wants to breastfeed. I can see it. And, that sometimes there's a lot of tears and then I usually cry with her because I want it just as much for her as she does. And like I said earlier, sometimes being that first person to tell her that it's really hard.
Options. I mean, there's formula, obviously.
Yeah.
There's donor milk.
Donor milk.
And that can be informal donor milk, or it can be more formal donor milk.
Yes.
Speak to that.
So informal donor milk, I always tell moms, if you have a friend or somebody that you know and you trust and you're able to get donor milk, 100%. But I leave that up to them they have to procure it and all of that. And then donor milk, obviously, if you're getting it from the milk bank, it is very expensive to get, but I'm 100%. I think donor milk is a great option. Obviously mom's milk is first and foremost. And if her milk is not available, then donor milk would be the next best option. And then if that's not available, then formula. But as somebody who has sat on the board of directors for a informal/formal milk bank years ago, I think it's wonderful.
Do you ever find yourself curious? I mean, obviously, this is something that has been present since the beginning of time.
Yes.
I find myself curious about things pediatric, just wanting to drop into different eras and what breastfeeding difficulties 300 years ago, 1,000 years ago.
Well, I think if they had
ago.
issues, they just found a wet nurse, and so I would love to go back in time and see how things were done. And then I would love to have the superpower of X-ray vision so I can see breastfeeding in real time. That would be my superpower that I would want.
There's been so much well-intended encouragement and emphasis. It really seems like almost during our professional spans. And again, I think it's good. Do you think it's all good? Do you think it has been, again, exaggerated in any way, made moms feel if moms can't, or even if they choose not to? Some moms choose not to.
Yeah, some moms do choose not to. I feel like with the age of social media and everything like that, I think some moms, if they're choosing not to breastfeed or if it's hard for them, I feel like there's a lot of mom shaming that happens sometimes. I really do. I try really hard in my practice, and obviously my practice, it's just me. I talk like I've got like 5 employees or something, but I try really hard to just meet these moms where they are in their journey because it's theirs. It's not mine. It's my job to walk alongside them and support them in this journey, no matter what that looks like. It's not my journey. So I feel like, I don't know. I feel like it's a hard time to be a breastfeeding mom,
or a non-breastfeeding
or a
mom.
non-breastfeeding mom. Yeah. Because there's so much information out there and sometimes it's not always the best information.
Yeah. Sometimes we will, when it's, moving in a direction that it's not going to be a continuation of breastfeeding for whatever reason, you'll try to reason and be rational, even though when I step back, I know this isn't rational, it's emotional, but kind of trying to rank, where is this in the importance of your child's outcomes?
Yeah.
And not saying it's not important, but this is not in the top tier of,
in the grand scheme of things.
I mean, kids being loved and supported and educated, all these other
Yes.
things.
So one of the things that I tell moms is that if you ever find that, because sometimes I put these moms on a triple feeding plan where we're nursing, we are bottle feeding, whether it be breast milk, donor milk, or formula. And then I'm having her pumping to try to increase milk supply. And so that plan is exhausting. And if we're still not seeing an increase in things, or she's doing more pumping than she is bonding with her baby, my question to her is always, do you find that you're bonding more with this pump than your baby? And if you find that this plan is not working for you, then we need to find balance within your family unit to where you are bonding more with that baby and not that breast pump. Because you only get this time with your baby once. And then once it's gone, it's gone. You don't get it back again. And so if this isn't working, then we need to find a plan that works to where you are bonding more with that baby.
What about things mothers, I'm sure they ask you, what can I do to increase my milk supply? So not pumping, but whether those be supplements or other things. I'm sure you get asked about this.
Yeah, we do. And it's a fine line because as IBCLCs, we're not allowed to diagnose or prescribe. So it's a really slippery slope with that. Yeah. I mean, obviously, you can walk into Target stores and find supplements, but it's really knowing her full medical history. Like, what is the reason? There's a reason why we're not making milk. And that's what we really need to dive into more and play detective, find out why. There's usually a reason why. And so that's what we have to really find out what's happening for the whole picture of this mom and baby.
Great. Another trend that has spanned our professional times, and it's being written about a lot, is the really dramatic rise in tongue tie, ankylosing, and the role that it plays in breastfeeding difficulties and the varying approaches to that. I assume that's something you've seen.
I do. Yeah, I do. And I take it on a case by case basis with each mom and baby and see what I'm seeing. I like to look at the whole picture of the mom and baby. So it's hard to just, one size fits all with each baby with that.
You guys are thrust into these situations. Is it primarily, well, you should talk to your doctor about how do you handle those? Because it's, the information is coming to them, not from you. It's coming to them from a friend or a website or whatever else.
From everybody, the internet. Yeah, it's all over. So that's a really challenging question. I mean, obviously with us not being able to diagnose, we would want to refer back to the pediatrician, and get, that kind of advice on that. But I really, again, want to look at that whole baby and picture. What am I seeing before I make any kind of judgment call on
oral
that.
motor things, oral motor issues that you're saying that really isn't in the purview of IBCLC,
not
the diagnosing of that, right? It obviously there's interplay.
Yes, there is interplay. I have a great referral list of providers that I refer out to if I suspect anything like that. Great. Because I like to stay within my lane.
There you go. Is there anything that you wish society, so not just so I'm giving you a little more powers than maybe either one of us have, but is there anything you wish society would do differently regarding breastfeeding?
Offer moms more support, readily available support. I mean, I believe that all moms need to have access to breastfeeding support should they choose to have it.
Is it not, how routinely is it covered by health insurance?
Well, it's supposed to be covered by insurance, but not all insurance companies, they will say that it's covered, but whether or not they actually cover it is a different story.
Do they distinguish between in hospital and once they go home?
That I'm not sure. I don't know how hospital does their billing.
Yeah.
I'm not a practice that takes insurance, so I provide a super bill for my families to submit and get reimbursement. So how the insurance side works, I'm not really sure because I actually really love to do client care.
Yeah.
So
that would be something society could do better, would be making it more.
And not just lactation support, but prenatal support, postpartum support on a whole for mothers,
I'm sure postpartum depression. I mean, that's
postpartum
obviously
depression, anxiety, and
comes
things
that,
like that.
You're coming across that a lot. Again, going back to that idea that you are journeying with them in this important season. Okay. What about sources of really good information for nursing mothers outside of Brooke Simmons.
Yes.
What would be sources of good information?
So I've got a couple of really good websites that I can refer moms over to. One is the Physician Guide to Breastfeeding. She is a doctor out in California that is phenomenal. Her website is great. Kelly Mom is really good. She's been around for a long time. And I've got a funny story about Kelly Mom. I went to a conference many, many years ago, and somebody had said, "Oh, Kelly from Kelly Mom is here." And I was like, "No way. I used her website when I had my youngest."
So the
And
original Kelly was there.
The Kelly from Kelly Mom was
Huh?
there. And we had all been out to lunch, and I was sitting right next to Kelly
Oh.
from Kelly Mom. So it was a really cool moment for me. Her website really helped me a lot when I was nursing my youngest baby. So that was a cool aha moment for me. So I use her website, and then I've got another Global Health Media is a good website for videos and things like that.
How can patients or parents find you?
So I have a wonderful website with online scheduling. So if a mom is having a hard time at 2 a.m. and wants to schedule online, she can schedule her appointment online for the next day if it's available. So everything is online. It's great.
What are some common breastfeeding myths that you come across?
So one of the newest ones that I've been hearing a lot is that if you eat 6 Oreos, it will increase your milk supply.
I would love that one. That sounds.
I think it's great.
Yeah,
Let's all
just
go
not
eat some
true.
Oreos. So the mom that tells me that she ate 6 Oreos and her milk supply increased, I have so many questions for her. Like, were you not eating enough before and you ate
Enough
6
Oreos?
or
Just
in
enough
general,
anything? Okay.
and then you ate 6 Oreos and you had this big calorie boost and you started making more milk. So I have so many questions for her.
Or maybe just trying to justify eating more
if you want 6
Oreos.
Oreos, I'm
Right.
all for it. My trainer says, if you want an Oreo, go eat an Oreo. It's fine.
Does your trainer say 6?
She didn't say 6
Okay.
though.
Right.
Yeah, no 6.
What other myths? Any others come to mind?
Grandmas have a lot of things that they tell moms not to eat. Spaghetti sauce,
Right.
onions, garlic, spicy foods. And so my thing is if you ate all those things when you were pregnant, keep eating them. Eat them all. Eat the spicy food if you like spicy food. So it's not really a big thing.
Yeah. I do think we see that same thing, even as it relates to other things. And my mom and I used to have this discussion, and in talking to her, I would find, in fairness to them, I do think they were often told these things by pediatricians or other people, even though they weren't necessarily true.
Yeah.
The grandmothers, they came by it honestly.
They did.
Yeah.
They really did.
This is something that has literally gone on since the beginning of time. And so one would maybe think that there is no evolution of the field of breastfeeding. That's probably not true. Science is always advancing. How have you seen things change in your time, if at all?
I mean, I feel like breastfeeding is just going to be breastfeeding. We're going to learn new things about different conditions and ways that we can help mothers. I don't feel like, honestly, it's really changed a whole lot since I've started. I feel like I'm still really new in this field of lactation. I've only been in IBCLC for coming up on 9 years. So it'll be interesting to look back on this podcast and say 9 more years and see what has really changed then.
It's interesting because maybe more than even some other aspects of medicine, it does feel like breastfeeding has deep societal roots, relationship, family, and with people being less tethered to older generations of this family. I almost wonder if there has been some regression in breastfeeding understanding, not on the part of IBCLCs, but on the part of the average parent, just because of not the lack of scientific understanding, but societal changes.
Yeah. It's funny because I asked my grandmother when I first started doing this line of work, did you breastfeed? And she's like, no, they gave us a shot at the hospital before we left to dry up our milk.
Interesting.
So.
Well, there's definitely, similarly, my mother's generation, even though she wasn't told this, others have told me that they were told, oh, the formula is better. Don't breastfeed. And there have been other aspects societally that have discouraged that breastfeeding meant you couldn't afford formula and all these other things that have been detrimental.
Yeah.
You mentioned that helping moms relax is helpful and maybe even essential for good breastfeeding,
Mhm.
what do you have in your bag of tricks to help them relax? Any calming
So
things?
one of the first things that I have her do is if I can see that she's really anxious before I even, because I have a routine of things that I do. I weigh the baby and then I get, baby over to her to get ready to feed. And if I can see she's really stressed and anxious, you see those shoulders way up here and you can almost see that jaw is so clenched tight. Sometimes I'll have her just close her eyes. I'll turn the lights off in my exam room. And then I'll have her close her eyes and then we take a couple of deep breaths in and we blow it out together. And I mean, there was one time I had to have this mom do this like 7 times before I could visibly even see her shoulders come down. And once I did, I handed her her baby and that baby latched so beautifully.
Is that part of your training at all? Not a bit.
No, that's
Yeah.
just,
Picked up through experience.
yeah.
Yeah.
Yeah. I mean, if she's super tense and she's super tight, as soon as I hand that baby to her, he is going to feel every part of that. I mean, I think about these babies being in the womb and he's got this nice calm mom for his whole entire life. And then if I go and hand this baby to this anxious mom, you can almost see the babies start pushing away immediately. So I really just try to work on getting her super relaxed and just good positive affirmations that she can do this and we're going to work through it together.
Yeah, it in some ways you may feel like it's not in your lane, not what you're trained to do, but I imagine it is a really important part of healthy
Yeah.
breastfeeding. And so there's some similarities with us and mental health that in some ways we weren't trained to do some of the mental health that we now have to do.
Yeah.
But it's just part of pediatrics.
Yeah.
And so you have to acquire those skills.
Yeah. And it's not just the mom. Sometimes it's even getting dad to relax a little bit
Sure.
as well. Yeah. It's the whole family. It's the whole family.
Yeah. It does seem like the paternal support is a big thing. I don't know if there almost needs to be a one pager or a couple little, again, equipping the dad is what does supportive look like? And
Yeah.
because again, I think most really want to be, I do think that, but you can imagine if someone is struggling and it's hard and then the voice coming at you is, why don't you just, that it's going to be easy to give. Yeah. So a supportive father is an important part.
Well, I usually have dad, I usually will hand the baby to dad to burp, teach him a lot of really good burping techniques and make him more confident in holding baby. Sometimes that's a big one for him. And just helping him to diaper sometimes. Sometimes a lot of what I do goes beyond just helping mom breastfeed. It's helping them to kind of settle into their role as new parents. Sometimes I'm working with mamas and daddies that have never been parents before. So just those little things of, tuck the diaper a little bit tighter or swaddle him up like this. And just those little things go a long way for these new parents. And you can just really see them kind of relax a little bit better. And it's those little tips that they really take in that matter.
And that really is sort of like this what I was saying earlier about midwife, kind of this continuation of someone has said, I want to walk alongside you through pregnancy and delivery.
Yeah.
And now I want to walk alongside you through this early part. We all need people to walk alongside us. We have some rapid fire questions that you're just going to have to answer top of your head. Anything else you would love to pass along as it relates to breastfeeding and breastfeeding support?
Breastfeed your baby.
Encouragement.
Yes. Just keep breastfeeding. It's really hard in the beginning, but take it one feeding at a time. You got this.
Yeah. All right. Are you ready?
Yes.
The first question, just very basic stuff, just quick as you can answer. Dog or cat?
Dog.
Dog. Mountains or beach?
Beach.
Coffee or tea?
Coffee.
What would you be professionally if you were not a lactation consultant?
Ooh. So pre-kids, I wanted to be a NICU nurse. Yeah.
Great. Okay. Do you know what a walk-up song is? Like when in sports, if you're, So better walk-up breastfeeding song. So you're walking into an appointment. Okay. That's what Pump Up the Jam by Tectonic.
Okay.
Or Milkshake by Khalees.
Milkshake.
All right. Got it. Two different professions. I want to know which one you think you are more like. You almost may have answered this for me earlier. A golf caddy for the mom or a sommelier for the baby. Which do you see yourself more as?
Golf caddy for the mom.
Okay. Coming alongside the mom. If you had a magic wand that had only one trick and you could fix this, this can have nothing to do with breastfeeding whatsoever.
Mhm.
What problem would you love to fix?
Mm. I think I would make all moms make milk. I mean, we're talking about breastfeeding today, so let's go with
You-
making moms make milk.
You are consistent. We love
Yeah.
it, and passionate about what
Yeah.
you do. Hey, thank you so much for what you do. Honestly, a lot of the purpose of this podcast is trying to come alongside parents and help them care well. And we want to highlight others in the community that are caring well. You've done this for so long. You've done this for so many of our patients. And on behalf of our patients, I just want to say thank you.
Oh, thank you so much for having me. I
Oh,
appreciate
it's been
it.
fun. You're the best.
Thank you.
Right.